Hello, I'm Public Health Commissioner Jeff Howard. Today I would like to talk to you about HIV and new concerns for public health practitioners and the provider community. While I'm not trying to alarm anyone, I want Kentucky providers to be aware of a recent shift in the way HIV is being transmitted in some regions and understand why it is a concern for our communities, the public health system, and the state as a whole. Current trends specifically reflect that more cases of HIV are being transmitted among intravenous drug users, which is concerning for a state already grappling with high rates of substance use disorder. To give you a better understanding of why this trend caught our attention, in 2014, Northern Kentucky reported only 2 cases of HIV with injection drug use as a risk factor. By the end of 2018, there were 29 cases with that risk factor profile. Statewide, the number of HIV cases with injection drug use as a risk factor increased from 22 cases to 69 cases during that same period. Soon after, we learned that HIV cases linked to injection drug use were also increasing in Cincinnati, just across our northern border. Anytime a potentially deadly infectious disease changes patterns, it is cause for concern and causes us to alter the way we think about the disease and prevention. Along with our partners at the Centers for Disease Control, Ohio, Northern Kentucky Health Department, we quickly took action and initiated a cluster investigation in the Northern Kentucky-Cincinnati area to gain a better sense of what was going on, how HIV was spreading, and where testing and services could be applied to stem the tide of new infections. In the spring, we partnered with the University of Kentucky to launch the Kentucky Income Reimbursement Program, CIRP, to expand treatment and professional services for persons living with HIV. CIRP, which launched in Northern Kentucky and will expand statewide over time, uses existing funds and leverages harm reduction programs to expand services, education, and care. Resources will also be devoted to education and training for the medical community. We are excited about the potential of this program, not only in terms of preventing HIV, but for what it can teach us about serving our community, reaching those in need of services, and improving the collective effort of health in our state. Yet there's still work to do. Addressing this issue cannot be solved by public health alone. More recently, public health officials and the medical community in Cabell County, West Virginia, just across the border from the Ashland area, noticed a similar spike in the number of new cases of HIV linked to intravenous drug use. There are now 49 confirmed cases. As we learned with hepatitis A, controlling the spread of infectious disease amongst drug users who are often homeless and transient has introduced a new challenge for public health. We have learned that reaching the at-risk population means meeting them where they are being housed, where they are getting their meals, and where they encounter the medical system. This could be a homeless shelter, an emergency department, or a correctional setting. We have examined our database of HIV cases for Kentucky counties bordering West Virginia. At this time, there's no increasing trend in HIV in the potentially affected Kentucky counties. We continue to closely watch the case reports from the Kentucky counties bordering West Virginia and the associated risk factors, but we have seen no changes. We have also alerted the health departments for the Kentucky counties that are bordering West Virginia about the HIV cluster in that area, and they are aware to contact us if they notice any changes locally or if they need any assistance. Ultimately, however, this is about how we work together as a community and a state. As providers, you hold the key to helping diagnose individuals and link them to the care they need to manage HIV and prevent the spread of this virus to others. Let's work together to limit the spread of this infectious disease, connect people to care and services so they are on the path to recovery and wellness, and let's heal the many Kentucky communities who have been struggling for far too long. Thank you very much and have a good month.